Hello, I'm Dr. Priyanka Reddy, General Pediatrician Consultant, Rainbow Hospitals. We'll understand the new concept in pediatric health called growth pains. When growth happens, there are a few changes that happen in the long bones of the body at different ends in different long bones of the body, long and short bones, which could be responsible for the subtle pain. Mostly it is a subtle pain. So growth happens by an interesting concept called ossification of an otherwise a soft tissue of the bone called cartilage. These cartilage cells will become bone cells by adding mineral to them. So chondrocytes become osteocytes, and as they ossify, the upper end keeps growing and lower end keeps solidifying into an adult bone structure. Now whenever this is happening, any change inside the body, even if it is a physiological thing like growth, or if it is happening secondary to some infections or allergies or trauma or cancer, etc., all of them follow a very universal internal health thing called laws of inflammation. So the inflammation is nothing but when you have a cough and cold, you find some soreness, that is also inflammation. When you have a small cut, you find some soreness, that is also inflammation. Likewise, when a growth is happening in a long bone, there's mild subtle soreness happening around that growth. But this sort of change, this sort of sensation of this mild subtleness is almost inconspicuous to a conscious mind. It doesn't know. But along with it, now the structures around the bone like muscles, nerves, connective tissue should also elongate and give a proper growth structure to the bone. These muscles now are a bit under tension, growing under pull. They also again produce mild subtle soreness or sensation to a child. Again, these things also follow under the basic normal inflammatory changes. In a healthy, fit child, these are also not much cognitive to a conscious child. But because all these changes per se need a very important nutritional underlying, like all the B complex vitamins, calcium, vitamin D, iron, etc., when they are deficit in a child, then the process could be mildly more painful than what it is supposed to be subtle. Hence, when we are dealing with a growth pain, we should first think about these deficiencies, correct them, and relieve a child of that mild discomfort, which is supposed to be a natural, pain-free physiological process. The advantage, there is a hidden advantage here in this growth pain, that at a very initial early stage, it is pointing to a child and to a parent that something is deficit, hence it is paining. It's good that we are addressing it at an earlier stage rather than the bone and muscle and tissues around grow into an ineffective, non-fit format. But if you're addressing them at the very initial growth pain stage, you're correcting all the required vitamins, minerals, any other internal required fitness of a child's health. Hence, they attain their more staminatus stage.